Okay, so guys, let's start with some of your feedbacks. I'm getting feedbacks from all of you, and those are really overwhelming about the classes, about the content what we are covering in the recent classes. And it's really lovely to see your comments, guys, that you people are really appraising the classes, and you're really praising how I was taking the classes. But there were two comments, there were two feedbacks what I really liked. I would like to tell you guys. Okay, I'd like to tell you guys, and I would like to answer for those. So the first comment was like the first what we say suggestion, or the comment or feedback was, sir, why don't you teach on laptop? Why you teach on iPad? We want to see you also while you teach. Okay, that was great. But guys, see, some classes are, when I read, if I have to take class today evening, I read the whole day, or the last night also I go to the laptop and prepare those classes. I also make notes because I'm also not expert of everything, right? I mean, I know the basics, but when I am taking classes for you, I have to be very specific, and I have to get the new information for all of you, right? And when I prepare the notes, that is in the laptop. And definitely I don't prepare the PPTs. The second thing is, I don't prepare the PPTs. And the first thing, my laptop has my notes, right? So while I take your classes, I look into the laptop. I look into the laptop and I teach you in that, so I don't have to prepare the slides. Okay, first comment was that, and I thought like I should share this with you. So first of all, thank you, whoever was for this comment. But you should understand my concept also. So that's there. And the other comment was, what was the other comment? What was the other comment? I really forgot. That was about, yeah, that was about like, sir, why are you not teaching with questions, MCQs? Your teaching with MCQs is something which everyone likes. I know that that is one of the very innovative method where we can learn not only about the correct answer, where we just not understand about the concept of the topic what we want to discuss, but we learn even out of the box. Even when the answers are not correct, we talk about those answers also, right? We talk about those answers also. But see, there are some topics like those are completely practical. What I'm teaching you in last two classes was not, you know but not the subject to teach by the MCQs. Because when I was teaching you the practical learnings, when I was teaching you the when I was preparing the practical live examples of the studies, when I was teaching you like how to conduct the studies, what kind of studies you can conduct, and in that, when I was preparing the live examples, when I was showing you the live examples, that cannot be discussed in the that cannot be discussed at all in the MCQs, right? So that's why I did not come up with the MCQs, and I totally have to go with the content, because content is sometimes very very important. Questions, definitely, I know, I understand. And that's why in this course I have discussed all the questions initially. Okay, 10-15 questions. I mean, I have a lot of questions related to that. Literally, I'm telling you, I have a lot of questions, but I believe the content is important, because the content is, very kind of practical and my experiences. So I cannot prepare the questions on my experiences, and content is really more. So I have to go to the content directly. But definitely, I'm sharing my experiences through the examples and whatever I have learned. So that is the reason why I'm not teaching right. I mean, I cannot teach through the everything. I cannot teach through the questions. Okay, so guys, let's not now delay much. I just wanted to discuss these two feedbacks. So now let me share this screen. You guys tell me. So let me tell one more thing, guys. Before I start today's class, let me tell you that today's class is going to be long. Okay, long means at least up to 8:45 or maybe 9, maybe 2 hours class. Okay, maybe 2 hours class, because I have two topics which are remaining from the course, from this course syllabus. One is like the process of DUE and DUR is remaining. The steps in DUE and DUR are remaining, and the second is artificial intelligence and ML in DUR. Okay, artificial intelligence and uh, uh, ML in DUR is remaining, right? So I have to talk about these two. This is very, very important, because that will tell you, I mean, the process I'll take just 15 minutes, 10 to 15 minutes, and then I'll be completely shifting to use of AI ML. And I'm very sure, guys, that you must have not even heard of the things what I'm going to discuss today. Okay, you must have not even heard of those topics, those content, and those methodologies what I'm going to discuss with you today, okay, in this class. So this is amazing. This is going to be amazing, and you are going to learn a lot from this class, because I really went into depth while I was searching like how you can use artificial intelligence and machine learning, and then I came through something called digital therapeutics, and then a lot of other things that I'm going to discuss today. Okay, so it is going to be fun, definitely stay tuned, and class is going to be long, definitely, but I have to complete the syllabus and I have to complete these topics. So be with me and try to be interactive as always. It's not like that I have no PPTs, then I will not have the questions. I have the questions, I will have a lot of questions to you. I will make it completely interactive. I'll make it completely interactive, as I always, try to be in my classes. So, yeah, with that, I will take a break, no problem. At 8:15, we will take a 5 minutes break, and then again we'll take the class, because 2 hours class I can understand will be quite tough for you. But we will take a 5 minutes break in between, no problem, anytime. Okay, anytime after 8. So let's start, guys. Let me share my screen so you can easily understand. Okay, and let's start. By the time, I have one more question to all of you. What do you think, or how do you think the DUE or DUR studies are being conducted? Yes, guys, tell me how the DUR and DUE studies are being conducted. Yes, people. Yes, guys, answer. I'm looking for the answer. Yes, what do you think, like how the DUR studies are conducted? Okay, how the DUR studies are being conducted. What are the steps in DUR? Yes, people. What do you think? Do you know anything about DUR studies? How to do the DUR studies? How to conduct the DUR studies? Or how to conduct the DUR, drug utilization review? I'll not go to the research right now. I'll just ask you how to conduct the DUR. So, first of all, let me tell what I'm going to discuss now is steps in conducting DUE or DUR, right? This is the main thing. But before that, I'll give you a hint, like why we do that. Why we do that? So we just try to find out. Our main objective is to find out, to ensure if the drugs are being used being used appropriately, right? Appropriately, safely, and effectively, right? That is our major thing. That is our major, concept behind conducting the DUR studies. Major concept behind conducting the DUR studies. That is the major part. Okay. So with that, I would like to ask you guys, how would you conduct the DUR study? If I tell you, like, you have to conduct the drug utilization review, you have to conduct a review, what would be your method? How would you do that? How would you do that, guys? Yes, people. Any idea? Come on, guys. This much, so now you should know that we are discussing DUR for last 3 days. Yes, people. Anyone? Any idea? Guys, come on. There are 60 people except me in the class. Yes, people. By preparing hospital formulary. Amazing. By preparing hospital formulary. Okay. Preparing hospital formularies. Okay. Little more. Yes, collecting patients' data. Okay. Okay. So let me tell you, inclusive, exclusive criteria, those are studies. Yes. Okay. Let me tell you, guys. Let me tell you. So there are some steps. Okay. There are some steps in DUR process. Suppose we call it DUR cycle also. So if I have to do the drug utilization review or drug utilization evaluation, okay, for a single person or for the entire group or the community. So there are steps. There are steps. So first step here is, guys, you have to define the objective and scope, or you have to define the goal of evaluation, why you are doing this evaluation, and you have to set the parameters, right? You have to set the parameters, right? I'll tell you one by one. So first step here is define the objectives and scope. So what does it mean by defining the objectives and scope? See, it is very important whenever you are conducting any kind of review, drug reviews, right? If you are conducting any kind of reviews, you should know what you are going to do and how you are going to do. How you are going to do, right? So you have to define the clear goals. Okay. So you have to define the clear goals. What are your goals behind conducting this? And you have to set the parameters. I'll give you an example here. See, you want to conduct a drug utilization review program for, like, opioid prescriptions. Let me give the example here. Opioid prescriptions, right? Opioid prescriptions, this is the example I'll take here. Or suppose opioid prescriptions, right? So you want to check if the prescribed dose and quantities are within recommended guidelines, and whether the high risk patients are also noted. Okay, so main thing is you want to check the prescription, actually the doses and the quantities of opioids in the patients, right? If they are given correctly or not. So this could be one target. So again, the second target is when you are using some sensitive drugs or some specific drugs which are really narrow index, or the wider index, or some kind of specific antibiotics like penicillin. So you have to check if those are in the correct dose and in the correct patient at correct time, right? So for that, this is your goal, right? Your goal must be clear, your objective and scope must be clear, right? So why you are defining the objective and scope? There are multiple reasons. Okay, there are multiple reasons. In the first step, there are multiple reasons why we are doing it, defining the objectives and scope. We are defining the scopes and objectives because, like, we should know how we are conducting and what we are doing, right? What and how we are doing, right? What we are doing and how we are doing, and even why we are doing, right? We discussed this: how, why, and what. These three things are very, very important when we are conducting DU or DUR study. So how and what, when we are deciding the objectives, what exactly will be there? Like, first of all, first of all, in like what drug we are using, what drug we are targeting, what is the specific drug target, what drugs or what drug target we are taking for review, right? And then we have to look at in the drug target we have to look at the therapeutic class, we have to look at the indications, for which indications we are using it, right? And then we will be talking about the appropriate drug use, appropriate drug use by how, like first you can go for the adherence, you can go for the medication errors, right? You can go for the drug interactions, you can check the cost effectiveness. I mean, multiple things you can do when you are focusing on the appropriate drug use, right? And then you should be very important and very careful about timing of the study, timing or the period of the study, or duration of the study we can call it. Okay, duration of the study, like if it will be monthly or yearly or quarterly or annually, because we are not talking about research study here, we are talking about the drug review. So after how many months, after how many weeks, after how many days the review should be done? Like suppose we are talking about the opioids, we are talking about the narcotics, we are talking about some other specific high sensitivity drug, high sensitivity drug. So we have to check like the perfect goals, perfect objectives and scope. The first step is defining the objective and scope, right? And once we have the correct our scope and objective, then we go for the second step. And second step is based on this, based on the objective and scope, we should develop the criteria, right? Inclusion exclusion we were talking about, so we should discuss the criteria, develop the criteria and guidelines. Guidelines, right? We should develop the criteria and guidelines. What is criteria and guidelines? See, first of all, the purpose of criteria and guidelines is, as we don't know that criteria and guidelines are not other guidelines, but in specific hospitals or specific communities or community centers, there are some predefined guidelines, right? Some predefined guidelines. Okay, this much would be used, this drug would be used, and this dose will be used in such patients, what would be used. So there are some specific criterias for use. Okay, there are some criterias or guidelines to use the drugs in the hospital, in the communities, or in chain of hospitals. They prepare their own guidelines, right? They prepare their own guidelines, that we call it course in hospital, right? Course in hospital or course in institute or institutional course of drug, or some there are different courses based on their doctors, based on their users, based on their prescribers. There are multiple things, there are multiple things. So based on those things, we prepare the specific criteria or guidelines, specific criteria or guidelines. Suppose what exactly we do, we do in this. So when we are talking about predefining guidelines are there, so what we do is we get the evidences, like we don't just prepare directly, like how much should be used, where should be used, based on our local conditions, based on our local availability, based on our local staff, based on our local practices. We should definitely make guidelines, but we should not make these things directly. We should use the clinical guidelines, right? Clinical guidelines, international and national clinical guidelines, national formularies, right? National formularies. And we should take the expert consensus also. Expert consensus means like the doctors, experts we call them, and then based on that they develop the criteria, right? They develop the criteria, and that criteria must be used for the appropriate drug use, that must be used for appropriate drug use, right? So we should develop the criteria, we should develop the criteria. And not only developing the criteria, we should ensure that these guidelines are aligning with the best practices, aligning with best practices, best practices, and like as we have the guidelines for hypertension, diabetes, pain management and all. And then along with doing these two things, we should do very very importantly that you should identify some, indicators. You should identify some indicators. Indicators means like we call them, like the correct drug selection, correct dose selection, duration of the therapy. Those are the indicators for the correct, for the, what we say, that for the appropriateness, right? There are called as identifying the indicators for accuracy. Okay, accuracy. So what are those? Correct duration, usually correct duration, correct frequency, right? Correct frequency, correct dose, correct drug, right? Those things must be included in the criteria development. So till now what you have done is, you have done two things. First thing was that you found your objective and scope of DUR, and then you made a criteria accordingly. Right? And once you are done with the criteria, you start collecting data. Okay, you start collecting data. So how to collect the data? You all know that. I'll not go into this much. You collect the data from hospital records, EHRs, or pharmacy systems, right? Pharmacy dispensing systems, we call them pharmacy systems. We get it from the prescriptions. And prescription claims means from the insurance companies, and from the hospital databases. You collect the data from wherever you can possibly do that, and you definitely, what we collect from all these resources, you collect the prescriptions, you collect the doses forms, you collect the dose, you collect the patient's diagnosis, usually collect the demographics, underlying disease, whatever you need to review the prescription, right? Like suppose you want to collect a prescription data for the patient who is receiving statins, to analyze the adherence to the cholesterol guidelines. So you will be collecting the data of the hospital, you will be collecting the data of the doctor, you will be collecting the data of the patient, you will be collecting the data of the drug, which drug is given, you will be collecting the investigation report, all cholesterols and all, right? So you have to collect the data, and then once you are done with the data, you have to do the analysis. This is simple. DUR is very simple. Let me tell you, DUR is very simple. Then you have to analyze the data. You have to analyze the data. You all know how to analyze the data. So we just analyze using the statistics, right? We do that during the statistics, like we have all the tests. We have we check frequencies, we check percentage, we check quartiles, and we go for the high end tests, high end tests, like the chi-square test, right? Chi-square test, and these t tests are there, parametric, non-parametric, ANOVA, you know. So there are multiple tests, and regression analysis. Regression is not usually used in diagnosis, but sometimes survival analysis. So there are multiple things what helps us in analyzing the data. Once you analyze the data, what you get is, you get results. And that we also call it, we also call as identifying the issues. Okay, once you are having the data, you identify the actual issue. Identifying the issue at this point of time, like what you are identifying at the end, what we have planned in the early step, like some unnecessary prescriptions are there, incorrect doses are there, right? Incorrect doses are there, or maybe unmonitored therapy is there, right? Unmonitored therapy is what, guys? Can tell me? Unmonitored therapy, give me the example of unmonitored therapy. Yes, I'm expecting at least 5 answers on unmonitored therapy. Yes, please, guys, what do you mean, or what do you understand by unmonitored therapy? Yes, people. Unmonitored therapy. Yes, unmonitored therapy, guys. Come on. Yes, people. Guys, come on. What is unmonitored therapy? Yes, guys, come on. Not looking on altered lab parameters during the course of medication. Not looking on altered lab parameters. Okay. Okay. Drugs without indication, OTC medications. See, fantastic answers. Fantastic answers. Without regular monitoring, if therapy given to the patient, okay, maybe. But the unmonitored therapy, the best answer I got from Anirudh, either the indication without drug, or drug without indication. Drug without indication. It is simplest answer. Okay, it is simplest answer because there are many drugs, misused drugs. Okay, there are many misused drugs. See, almost all the answers are relevant. I'll not say correct, but they all the answers are relevant, like inclusive and like the without regular monitoring. Okay, definitely not looking on altered lab parameters during the course of medication. Definitely, it is negligence. It is the matter of negligence. Then patient dose levels in the body, that is high end thing, that is something which is not possible at tertiary care centers or like other centers. But yeah, definitely definitely that can be done, but that is something which is not needed everywhere, right? So but the best examples are indications without drug. We left some indications without drug, and we have some indications, I mean, we have some drugs which are given without the indication. Okay, so drug without indication and indication without drug are the common answers. So we identify the problems, we identify the issues, accordingly, and based on that, what we do is, based on that, an appropriate drug, unnecessary prescription, incorrect doses, unmonitored therapy, and along with that, we talk, about not only these things, but the relevant patient also, like particular patient also, like in this patient, what was the age, what was the diagnosis, what was the medicines involved, what was the nature of problem, those things you do that. Okay, and here in the results also, you assess the severity, or you, what we say, you divide, classify, the problems, you classify the issues according to severity. So the prescriber, or according to severity, so the prescriber can focus, on the severe most first, and then it goes to the next, part, right? It goes to the next part. So what exactly, like, suppose I'll give you an example here, like, there was one study on the high dose, guys, focus here, high dose benzodiazepines. Okay, benzodiazepines. Okay, high dose of benzodiazepine were given in elderly patients. Okay, elderly patients. And what the medication review report shows, what the medication or DUR, what the DUR report shows, medication review report shows that there was the increased risk, or increased prevalence of falls and cognitive impairment in cognitive impairments in what? In elderly people using benzodiazepines. Okay, using benzodiazepines. So there are multiple factors, guys. There are multiple factors which can, really affect the human beings, and you don't come to know until and unless proper drug utilization is being performed. Okay, so that's why drug utilization is being performed, right? So after these results, you got to know the results now. Now next thing is DUR is not completed until you do some intervention, right? So this is the time to define the intervention and implement the intervention. Okay, implement the intervention. This is the time to implement some intervention, define the intervention, and try to correct the inappropriateness of the drug. Try to correct that. So this is the time to take corrective action. Take corrective action. Take corrective action. And what is corrective action here? What is corrective action exactly? Here corrective action could be, you communicate with the relevant. First thing is you communicate. First thing is you communicate with stakeholders, right? Stakeholders are who? First is prescriber, right? Prescriber like the doctor, and then the pharmacist, then other healthcare providers like nurses and all, right? You communicate the findings to the relevant healthcare stakeholders, and then you recommend the changes. You recommend the changes in guidelines. Whatever you made in the second step, you recommend the changes in guidelines. You changes in not guidelines, or maybe changes in not guidelines, actually the changes in practice, right? Changes in practice, prescription practices. Okay, like dose adjustment, alternative medications, or maybe the additional monitorings, right? And then you can also go for some development strategies like improving the medication use, and you can even conduct the education sessions to the prescribers. You can make some policy updates and all. You can do at this stage. You can do policy making stage and all that. And then once you are done with the intervention also, now what's next? Now you have to provide the feedback and documentation. Feedback and documentation. Without documentation, DUR is not at all complete. Okay, guys, without feedback and documentation, educate the documentation, DUR or DUE is not possible. So provide the feedback to the prescribers or relevant staff, and then conduct some education part or something if it is needed. But the main thing is monitor and document these findings. Document these findings, like whatever the entire process. Document the entire process, right? Document the entire process. Then like what were the objectives, what was the criteria, how was the data collected, or how did the analysis were done, right? What were the issues? So each steps, what were the issues found in this, and how you changed in the policies, right? How you changed in the policies. So everything must be done here. Everything must be done here, and then only your DUR gets completed. So I was telling about DUR cycle. There is a cycle of DUR. There is a cycle of DUR. And what is that cycle? What is the cycle is like? First is scope. You have to define the scope and objectives, right? Scope and objectives. Then the second phase comes is where you have to develop the criteria, right? Develop the criteria or guidelines, right? Develop the criteria or guidelines. And then after that, third is data collection, right? Data collection. How do we do that? What do we do that? We have discussed. And then the fourth one is very important: data analysis. Data analysis. And then fifth is like issues identified by results, right? Issues identified. Now if the issues are identified, what we will do is we will do some intervention, right? Intervention by informing them or reporting them, right? And then what we will do is number 7, we will take the feedback, right? We will take the feedback and we will document it. we will document it. Okay, and then the same process goes on. So this is called DUR process or DUR cycle. Okay, understand guys, this is DUR process or DUR cycle. So whenever you are doing it, now let me connect with the practicability, let me connect this with the research again. You know that I told you all about the research, how to do the research, how to conduct the research, how to use these steps in the research and all. You can definitely do that, but let me tell you how to do that here. See, everywhere, whenever you are using the research with DUR, you can get the data. You can get the data for all type of histories, either those are personalized medicine, those are drug utilization, drug appropriateness, or whatever type of studies you want, you can conduct using DUR process. You can conduct using DUR process, because whenever you are using DUR, you will get the data. You will get the entire data in this patient related data, drug related data, utilization related data, cost effectiveness related data, drug cost, everything you will get in the DUR process, and you can use that data in different type of research, different type of research, or different domain of research, what we have discussed in last 2 days, what we have discussed in last 2 days. So this is the DUR process, how you can conduct it. Okay guys, so now I'm looking for some questions from you. Any questions up to this DUR process? I have completed the DUR process. I'll go to the next part now. So any questions right now, guys? Please ask me if you have any questions. Don't wait. Please ask if any questions. Yes, guys. Any questions, people? Any questions, guys? Come on. How is it possible that you don't have questions? Are you sure you don't have questions, guys? Come on. Questions, guys. Come on. Did you understand everything? No one is responding out of 70 people. Come on. Okay. I'll consider it like you understood everything. Okay, fine. If you are not telling me if you understood or not, that's perfectly fine for me. Okay, but you should ask me some questions, guys. Come on. It is not like that you understood everything. You cannot. I'm very sure. Okay, if you're not asking questions, that's okay. Fine. So now I'll go to the one of the very important topic what I wanted to teach you for at the end. It is very important. So guys, so are you ready for this? Are you ready for this? Yes, guys. Yes, people, tell me. Okay, fine. If you're ready, then let's go ahead. Let's go ahead. I think let's start with the questions. Let's start with the questions. Let's start with some, let's start with some questions. Okay. Let's just start with some questions. Okay, one sec. Let's start with some questions. Let me ask you some questions. Then only you will be, open with me today in today's class. Okay. I'm searching for a good question. Yes. So, guys, I'm writing a question here. You guys, I think, are very friendly with the question. So, question here is question number one here is which technology is commonly used to ensure correct medication dispensing correct medication dispensing at the point of care okay. First is ml and blockchain. Okay, ml and blockchain. Second thing is VR, virtual reality. Third thing is barcode medication administration, we call it barcode medication administration, and then maybe AR, augmented reality, virtual reality, and augmented reality. So tell me, what is the correct answer? Which technology is commonly used to ensure the correct medication dispensing at the point of care? Yes, people. Yes, guys. C. Barcode medication administration. How? Why not blockchain or machine learning? Why not virtual reality? Yes. Why not virtual reality, guys? Come on. It could be virtual reality also, right? Why not virtual reality? Yes, guys, tell me. Why not virtual reality? Okay. So let me tell you one by one again. Let me tell you. See, ML and not blockchain, sorry, blockchain. Okay. So machine learning and blockchain are for automation. First of all, remember this. These are the technologies for automation. Okay. These are the technologies for automation. These are the technologies used for automation. Okay. And AR and VR are what? AR, I mean augmented reality, and VR, virtual reality, is are to create the scenarios. Okay, create the scenario. Those are virtual or augmented. Usually virtual or augmented, where you can see the people working similarly, people, you can see that, everything that looks real, but those things are actually creating. Okay, those things are actually created with the help of technology. Okay, so the answer is correct, barcode medication administration. Okay, so at point of care, when I'm saying at point of care and correct medication dispensing, that cannot be done with the help of like that can be done with the help of automation also, but it is the word commonly also. Okay, so barcode is important. So whenever the patient comes with a prescription and there is a barcode, just to click on the barcode, I mean just to take that barcode or use that barcode or scan that barcode, and the perfect medication can be dispensed. Okay, perfect medication or the correct medication can be dispensed, right? Correct medication can be dispensed, right? So this is how we use the technology of barcode medication administration. Okay, now question number 2 for all of you. I'll come to the deep learnings also, don't worry, but I'll come to that part also. But let me tell you know let me take one more question. Okay, let me take one more question. What is the key feature key feature of digital therapeutics? Digital therapeutics, we call it DTX. Okay, what is the key feature? First is answer number one is it requires physical device. I mean, there is a physical device. Digital therapeutics, there is a physical device. Okay. And there are always the evidence-based software. Evidence based software driven therapeutic intervention. Okay. Therapeutic interventions. Or the third is these are being used for primary use, the primary use in diagnostic purposes. Okay, digital therapeutics is diagnostic purposes. Or maybe the important feature again is it replaces all pharmaceutical treatments. All pharmaceutical treatments. It replaces all pharmaceutical treatments, right? So now this is the thing what's you have to tell me. Okay, so answers are very clear, question is also very clear. What is the key feature of digital therapeutics? What is digital? First of all, before we go to the answer, let me answer, let me ask this question to you. What is digital therapeutics, guys? What is digital therapeutics? Yes, people, tell me, what is digital therapeutics? Yes. Yes, guys, what is digital therapeutics? Yes, guys, come on. Yes, digital therapeutics. Yes, people. Yes, I want some answers, guys. I want some good answers. I want. Yes, people. Software-based intervention. Software-based intervention. Okay, this is the Google answer, but that is definitely good. Okay. Okay. Software-based intervention. Newly designed software. See, let me tell you. Let me discuss with you this only first. Digital therapeutics. Let's talk about digital therapeutics. Okay. Digital therapeutics. Digital therapeutics. Okay, what is digital therapeutics? So digital therapeutics is something definitely that is you know that is kind of interventions. That is kind of interventions. Interventions definitely in the patient's life or in the human life, right? In the patient's or human life, right? For for what? For what? We use them for disease management. Definitely, if it is therapeutics, then disease management only, right? Disease management, not prevention. Usually treat disease management, but also prevention, right? Disease management and prevention, these are some interventions which we use in the patients or human life for disease management or disease prevention, right? So what exactly is digital therapeutics? Let me tell you again. This is the clinical intervention, clinically validated interventions, not clinical interventions, clinically validated interventions. But how they use it? They use it definitely, using the softwares. Like software driven thing is, this is the software driven algorithms. Driven algorithms which gives the answer for your queries. Answer for your queries, right? Answer for your queries. and these are designed to prevent or manage or treat the medical conditions. Okay, and these are made by the rigorous evaluation of clinical trials, regulatory oversights, regulatory guidelines, and integration of entire clinical care. Like, these are something different, not like chat gpt. Okay, not like chat gpt, but these are very, very important. If you understand in this, there are three major features of digital therapeutics. First, it is completely evidence based. Okay, because it is based on the guidelines. Okay, then that is patient centric, personalized medicine kind of thing. This is patient centric. Okay, it directly goes to the patient through app, through web, web platforms, or through the connected devices. It is patient centric. Okay, and evidence based, definitely grounded in the clinical research and subjected on regulatory guidelines and all. And then third thing is data driven, 100% data driven. 100% data driven means it collects and analyze the patient data to personalize the intervention and provide the real time treatment, prevention, and then the feedback. Okay, so digital therapeutics is the software or application which is made on 100% evidence-based, medicine, or 100% evidence-based interventions, and it is patient-centric, and it is getting the decision. Decision is made completely on the data-driven algorithms. Decision making is completely by data driven algorithms. Data driven algorithms means first it collects the entire data from the patient. First it connects the entire data from the patients, and after that it analyze and do that, right? So most of the use of digital therapeutics we use in chronic diseases, chronic disease management, like diabetes and hypertension. Then we have mental health. And then we have neurological disorders, usually psychological disorders. I mean, there are a lot of things. And most importantly, in US and Canada, the digital therapeutics is used for two things, guys. Two things: lifestyle management first, lifestyle management, and addiction treatment. Okay, in US and Canada, this is used for two things, two major things. One is lifestyle management, and one is addiction treatment. Let me give you an example. In Canada, I was reading today, there is a platform called Reset. Okay, platform called Reset O. Okay, Reset O is for opioids, right? O is for opioid use, and reset is, like you have the patients are being reset from opioid use. This is for the addiction treatment. So this is the patient support system. Reset O is the software or application there, which is patient support system, right? Which is patient support system. And it combines what? It combines two things. It combines the behavior of the patient. It combines the physiological profile of the patient. Physiological profile of the patient. Okay. Physiological profile of the patient and behavior of the patient. And based on that, it you know it does that, support. It helps in supporting. अपने phone से कर ले. It helps that, in supporting that, supporting the patients in, what we say that, opioid cessation, or not using the opioids, or coming out of the, opioid use, or coming out of the opioid dependence. The multiple things are there in this Reset O, right? In the Reset O, there are multiple things. And if you ask me the example of lifestyle management, I'll give you the example of, there is one important app what is being used is Noom. Okay, Noom. So Noom is the application in USA, basically, that is a government affiliated application that usually promote the weight loss and healthy living. Okay, and it talks about the management, it talks about the behavior science, it talks about the coaching, it talks about everything which is being needed to do the weight loss and healthy living, right? So that kind of things where we take the help of technology, we take the help of artificial intelligence, we take the help of the new technologies. In that, we call that digital therapeutics, right? We call that digital therapeutics. There are hundreds of examples I can give. There are hundreds of examples I can give you guys. Hundreds of examples. Okay. There are hundreds of examples I can give you. But before that, let me come to the major point. What we were discussing about. What we were first discussing about use of artificial intelligence and use of AI, ML, and all in the DUR and DUE. That is our major subject to learn. I'll teach you that with example. So our major question is use of. I'll keep use of technology. Technology. Okay, use of technology like AI, AML, or digital therapeutics, and many more in DUE or DUR. In DUE or DUR. DUR. So you understood digital therapeutics, guys. First, basics of digital therapeutics. Did you understand? Yeah, sleep disorders or not. Did you understand a basic of digital therapeutics? Okay. So now I will come to this. Digital therapeutics is a part of AI and ML only. Okay, digital therapeutics is a part of technology, using the technology for drug utilization, for appropriate drug utilization. Okay, for appropriate drug utilization. Let me come to that now. So when we talk about use of technology in DU and DUR, DUE and DUR, there are some specific things. There are some specific things which comes in mind. There are some specific things which comes in mind. I'll tell you how you can how you can see them, how you can see them further. Okay, so let me tell you this. Okay, let me tell you this. So our thing is like use of technology. So how we can use? So there are multiple tools, multiple technologies are there. So if I write one by one, if I write one by one, first is artificial intelligence. First is artificial intelligence, right? First is artificial intelligence. We call it AI, right? And the second is machine learning, right? Machine learning, right? Second is machine learning. We call it ML. And then definitely third, there are some other digital tools. Digital tools, not the algorithms like AI and ML, but digital tools. There are available digital tools, like as we were talking about yesterday, like decision making tools and all, right? And then there is something called digital therapeutics. Just talked about, right? Digital therapeutics. So this digital therapeutics, and we actually digital therapeutics comes under AI powered interventions. Okay, AI powered interventions. AI powered interventions. Okay, AI powered interventions, and then I'll come to the different technologies, other different technologies, different techs, or we can understood it by benefits of technology. Benefits of technology. Right. So let's talk about benefits of technology only first, and then we'll come to artificial intelligence, machine learning, digital tool, and digital therapeutics. I just talked about that is AI powered interventions. So first, let me talk about benefits of technology in DUR and DUE, and then I'll come to artificial intelligence, machine learning, and some more digital tools. I have already talked about some digital tools in the last class. A little less, but yes, we have talked about these things in the last class also. But now first let's talk about the benefits. First let's talk about the benefits of technology in AI. I mean benefits of technology in DUE and DUR, right? Benefits of technology. Benefits of technology. So it is very simple. It is very simple. You will understand. First thing is it will enhance the efficiency. It will enhance The efficiency, how it will enhance the efficiency of the process, how it will enhance the efficiency of the process, guys, by automation. First thing is automation. So what you can automate by this, you can streamline the repeated tasks. You can you can streamline the repeated task by automation, like prescription prescription audits, right? Prescription audits. And you can do data collection, repeated data collection. You can do by the automation, right? You can do by automation, like automated drug utilization system are there, which are quite appropriate for the drug use, without manual review, right? So like when you want to when you want to cut down the manual use, or when you want to cut down the manual errors in the prescription audits, you can definitely go for the automation using the AI, using the technology. You can go for the automation, right? So automation, and then definitely it is you can make the things also time saving by that. Automation and time saving. How to make the things time saving? By by rapidly process the larger data sets, right? If, like, we call it big data analytics, right? Big data analytics. So not only the efficacy, enhancing the efficacy, then definitely by automation. And time saving, how to do the time saving? By big data analysis. Big data analysis can be done easily with the help of SAS, with the help of SPSS, with the help of technology, right? Nowadays, with the help of Python and other languages, when you can easily immediately do process the data of 1,000 people, lakhs of the people, millions of the people. You can do in hours. You can do not in hours, you can do in minutes. Okay, the big data analysis is one of the subject and one of the technology what you can use for the time saving purposes, right? And like you can do the you can you can do the real time alerts also. You can do the real time alert sending for the appropriate drug use, or the to reduce the prescription adherence and all. You can do that. Okay, and you can use the EHR also, that is electronic health records, right? You can use electronic health records for all these purposes, right? All these purposes you can do that EHR, right? You can use the EHR for efficiency management, or enhancing efficiency, right? And then with this help, not only you can enhance the efficiency, but you can improve the accuracy also, right? You can improve the accuracy also. How you can improve the accuracy? See, as I just told you, you can just do what you can by the if I'm talking about improved accuracy, that means I'm talking about reduced the errors, right? Reducing the errors in data entry, in data entry, in data analysis, right? And in data reporting. And data reporting, there are multiple faults. So we can minimize those faults. We can minimize the, we can improve the accuracy by minimizing human errors. Minimizing human errors by what? By using some kind of softwares, by using some kind of technology, like as I just told you, medication barcode, right? Or barcode medication administration. So this is called as BCMA, barcode medication administration, just to ensure that the drugs are dispensed properly. Drugs are dispensed matching the patient and matching the barcode. So we call it barcode match with the patient. Match with patient, right? So the appropriate drug will go to the appropriate patient. Appropriate drug will go to the appropriate patient. So we are using it for enhancing the efficiency. We can use technology to improve the accuracy, and we can definitely, then the third one, very important, is real time monitoring. Okay, real time monitoring. So this is definitely you can use in the research also. You can use in the real time alerts, real time monitoring. You can do that. Okay, real time alerts and real time monitoring, you can do that by the by the help of the softwares, by the help of the tracking devices, by the help of prescription trackers. by the help of prescription trackers, it is very easy. Okay, prescription trackers, right? Prescription trackers. And then, as I just told you, the data driven insights. So, data driven insight means like it can help us like digital therapeutics. So, data driven insights, right? Data driven insights like the if I tell you it in it usually analyze the large scale data to identify the trends in the drug use or drug misuse, right? Like usually in case of antibiotic we use it, in case of antibiotics we use it, right? In case of antibiotics we use it like we analyze the platforms to detect the regional overuse of antibiotics, okay, and that contributes to antimicrobial resistance. So in use of antibiotics, usually in utilization of antibiotics in the regional use or where we call it antibiogram, right? So in antibiogram for AMR, we can use the digital tools to drive the data or to get the data out of the entire system, out of the entire large scale data. We can analyze and we can get the problems, and based on that we can also do some predictive analysis, right? Predictive analysis is for what? It is like to forecast the adverse drug reactions or maybe the risks, right? So predictive analysis for ADRs, like whatever the ADRs are going to happen, whatever the drug related drug reactions are going to happen or drug interactions are going to happen, that kind of things we can definitely do that. And other than that, there are multiple other things where we can use the technology in cost effectiveness. In cost effectiveness, like by optimizing the resources and correct resource allocation means what? Resource allocation means what? It is like reducing the unnecessary prescriptions and preventing the costly errors. Like usually if I give you an example here, it's like we try to identify the inappropriate high cost drug use, right? High cost drug use, like where we can utilize the simple, see guys, I'll tell you the example. I'll tell you one simple example. See, if you look at the pantoprazole, like guys, look at the pantoprazole cost. Have you ever checked pantoprazole cost? I'm asking you guys, have how many brands of pantoprazole have you used? Tell me. Yes, guys. How many pantoprazole brands have you used, everyone? Please tell me how many brands. Pantop, okay. Pan 40. I'll write here, okay. Pantop, Pan, or then what else, guys? Pantocid, Goofy Pan, yes. Goofy Pan, then what else? H2 check, H2 check. Have you heard of this brand? H2 check, H2 check, and then what else? Yes, guys, tell me. Yes, people, tell me. Have you ever tried? Have you ever tried to know the cost of these drugs? Have you ever tried to know the cost of these drugs? Different. Yes, guys. Have you tried this? Yes. So I'm just checking real time. 15 tabs, 165 rupees. Okay, 165 rupees. And if I am going for pen, only pen. Okay, I'm using this. No, pen 40. So okay, 15 tab, 170 INR. Okay. And then if I go for Pantocid, yes, 15 caps, 245 rupees. Okay. And if I go for What is that? Goofy pen. Okay, I'll just check. See, goofy pen. See, guys, 10 tabs, just 55 rupees. Okay, and if I check this also, if I check this also, you will literally surprise, guys. You will literally surprise. 10 tabs, 53 rupees. 53 rupees. 53 rupees. 53 rupees. Understand? 53 rupees. Okay. So if you check these, guys, if you check these, you will see how much, things are there. See, Pentop is almost 11 rupees per tablet, right? 11 rupees per tablet, right? This is also 11.5 rupees per tablet. This is okay, 17 rupees per tablet. This is 5 rupees per tablet. 5 rupees per tablet. This is also 5 rupees per tablet. If I say 5.5 or 5.3. See, guys, why we do that? See, all the content are very good. All the companies which are, preparing these or manufacturing these brands are wonderful. Okay, then why we always go for Pentocid and don't go for this, and we think like Pentocid is perfect? No, this is the narrative set. This is the narrative set because this is the costly. Hospitals get high cut in this. Hospitals get high cut in this, high percentage. Even sometimes the doctors are involved, or the people who are in formulary making are involved in this, right? So by using the data, by using the data analytics, by using the AI driven models, we can always think of some cost effective things. We can always think of some cost effective substitutes. We can use some cost effective substitute which are helping the people, which are helpful for the people. Understand? So this can be done with the help of AI, which can be helped with the technology, right? Improving the medication adherence and reducing the hospital readmissions, and we can lower the overall healthcare expenses by using it. Okay, by using it. And then definitely it helps us even in enhance the patient safety. Okay, enhance patient safety. The simple example, people nowadays, Apple Watch are like indicators, fall indicators. If the patient is falling in the washroom or somewhere, they send the message, all alerts or alerts to the people or relatives, right? Peoples or relatives, right? They can send this message to the relatives and all. So this also is like patient safety is increased. And then definitely personalized medicines. Personalized medicines we can use by like tailored drug regimens based on individual factors like genetics, comorbidities, preferences. Again, AI powered tools recommends the personalized dosing strategies like anticoagulants and all, right? So there is a very very important use of AI and technologies in our life, and drug utilization and proper drug utilization. Okay, in proper drug utilization, there is a perfect use of AI and technology. Okay, now I will take you to the examples and all. So before I go to the examples and all, let's take a 5 minutes break. Let's drink some water. And exact now it is 2016. We will meet at 2020. Okay, we'll meet again at 2020. Just I'll drink water and I'll come back in 4 minutes. Okay, in 4 minutes I'll see you again, guys, and then we will discuss for 30 more minutes. That's all, not much. 30 more minutes I'll discuss. Okay, by the time you can come up with the questions also. By the time our AI and technology in DUR, right? So now I'll come to the main important part. Now I'll come to the main important part, which is actual use of AI. Actual use of AI with examples. I'll tell you. Okay, with examples, I'll tell you that. Okay, so yeah. Let me tell you one by one. As I just saw, we just saw and we have discussed like what are the uses of technology like AI, ML, digital tools, and all. So let's discuss one by one. First, I will discuss about artificial intelligence. Okay. First, I'll discuss about use of artificial intelligence. Okay, use of artificial intelligence, and you can definitely, you can make some studies over it, or you can think of that artificial intelligence in drug utilization review. Drug utilization review. Okay, or DUE. So first of all, what are the objectives? What are the objectives? And let's talk about some examples also. Let's talk about some examples also. So this is definitely revolutionizing. If we are using the AI in DU and DUE and DUR, that is definitely something revolutionary, and that is something we have a lot of things. So let me talk about AI in DUE about something in four aspects. Okay, when I'm talking about the use of AI in drug utilization, I'll talk about 4 5 aspects. First is like application. What is the core application? Okay, what is the core application of AI? And then after the core application, we will talk about what are the advantages, right? We must talk about the advantages, and we must talk about the disadvantages also, definitely the challenges also, right? The challenges. And then we should talk also, of course, about what are the AI tools we can use, right? What are the AI tools and technologies we can use, right, in DUR. So I'll talk about everything, and then examples, some important examples I'll take here, some important examples I'll take here. So let's start with the application. Let's start with the application of AI in let's start with the application of AI in DUE and DUR. So first of all, how the AI helps in DUE is, first thing is by pattern recognition. Okay, by pattern recognition. I will explain everything. Try to understand. Okay. If you're not understanding, please ask, because these are new things for me also. When I was doing PhD, that time, AI was not that prominent. It has come after Corona. AI and ML and everything
The
has come.
screen is not visible, sir.
Screen is not visible. Okay, wait. Oh, is it? I'm so sorry, guys. One sec, one sec. Yes, it was not visible. Perfectly fine that you told. Okay, great. Now it is visible. I hope now it is visible.
Yes,
Okay.
sir.
Okay. So I just written nothing, this much only. The use of artificial intelligence in drug utilization review. So I'll be talking about application, I'll be talking about advantage, challenges, AI tools and technologies, and examples, right? So the first, how the AI is being used, how the first thing AI is being used, the applications of AI is, first thing, it is being used in pattern recognition and predictive analysis. Okay, and predictive analysis. How? I'll tell you this how. So, see, like AI, we are talking about artificial intelligence. Definitely, we are talking about something which is intelligent, which is brilliant, okay, which is intelligent in itself, whether it is technology, but it is intelligent in itself. So, how we can use it? So, AI can, first of all, you should understand that AI can watch over the large amount of data, right? Large amount of data. It's very simple, very practical. I'm trying to make it like AI can watch about the large amount of data, vast data, right? Vast data. And when it can have a watch on the large number of data, definitely it can analyze it, right? Definitely it can analyze it in minutes. And after analyzing it, it can make a pattern of drugs. Pattern of drugs, how? Like, okay, this drug has been used too much, and this drug has been used less, this drug has not been used. Or it can, in the pattern analysis, it can tell the actual use of drug, actual actual use of drugs, how much use of the drugs has been happened. And based on that, it can talk about, like, based on outcomes. When it is talking about the data, it is talking about the drug use, it is talking about the outcomes, right? Outcomes related to that, those patients, or those the patient data and all. So what it can do by pattern analysis, in the pattern analysis, it can talk about the frequencies, right? Frequencies or pattern of the drug use, pattern of the drug use, right? And it can talk about the potential adverse events, potential ADRs or ADEs, like along with what drug, what kind of adverse event has happened, right? It can make the analysis chart, it can make the analysis pattern, like with this drug, what kind of adverse events has happened, what with another drug like B, what kind of adverse drug has happened, right? It can make a pattern, it can make a pattern, and along with that, it can select some high risk patients, guys, high risk patients, right? It can select some high risk patients, and it can analyze the ADRs based on death, based on hospitalization, based on the drug use, based on multiple visits to the doctor. Like, there are multiple indicators for the severity, like if the patient is going again and again to the doctor, that is multiple patients visit. If the patient is getting hospitalized again and again, that is again the indicator of high risk, right? So the pattern analysis can also talk about the high risk patients, pattern analysis can talk about the potential ADRs, pattern analysis can talk about the off-label drug use, off-label drug use, as we talked, like the drugs without indication, right? Drugs without indications it can use, right? So the first application of AI in DUR is pattern recognition and predictive analysis, right? In pattern recognition, and based on these patterns, it can recognize, it can it can analyze the predictions, it can check the predictions for the further upcoming year or upcoming patients lot or upcoming patients group. It can tell us about the predictions of ADRs, predictions of high risk patients, or in high risk we should use or not, in what type of patients we should use these drugs, in what type of patients we should not use in drugs, right? So pattern recognition and prediction analysis. Okay, see guys, now again I'll tell you, you will tell this is not practical. This is practical, definitely. You need some the people from technology, people from AI and ML side, and you can make such projects in practicality. Okay, you can make such projects, you can make such research in practicality. Okay, you can use them, you can utilize them in the patient safety reporting, you can use them in the I mean in the drug accuracy, drug appropriation. You can use those things, use these things, and you can definitely make your own software. You can use the available softwares, you can use the algorithms, you can prepare the algorithms according to your data, your patient. So definitely a little more stuffs, little more tension, little more efforts you have to put in doing such studies. But if you are doing such studies, these are remarkable, I'm telling you, these are remarkable, right? So this is the first thing, pattern recognition and predictive analysis, right? The second application could be that we just have discussed, real time alerts, right? Real time alerts and decision support. Real time alert and decision support, how the AI can help you in real time alerts. See, if we integrate, if we integrate our EHR, electronic health records, if you just connect the EHR with your patient data and with the AI, with the AI system. So what it can do, it can give the real time alerts about, as we just discussed, DD, drug interactions. It can talk about the patient allergies, right? When the patient comes to the hospital to meet the doctor, it can talk about the allergies, it can talk about the contraindications, right? Contraindications it can talk about, and it can talk about the evidence based recommendations. It can talk about evidence based recommendations, evidence based recommendations, right? And real time alerts about the drug adherence, right? About the drug or medication adherence also it can talk, right? So this is very very important, and it can be utilized at many places, guys. It can be utilized at many places, not only at one place in the healthcare system, but at different places. You can use the artificial intelligence, you can use these things very importantly. You can use these things in the drug utilization review, right? So real time and decision support, so it uses the evidence based recommendations and all. Then uh, real time alerts ho gaya. Then it is like personalized medicines, right? It can help you in personalized medicines, right? Personalized medication, personalized medicines. What? How in personalized medicine? How in personalized medicines, like it can optimize the dosing strategies, it can optimize the dosing strategies, right? Dosing, what kind of dose should be given, dosing strategies. Now you'll tell how it will be doing, I'll tell you. Then the it can tailor the medication regimens, right? How it can tailor the medications and the medication regimen. So usually the AI algorithms, right? AI algorithms, what they do is AI algorithm process the patient specific data, right? There is a patient specific data in EHR, electronic health records. It takes all the data, patient specific data, including genetics, including biomarkers, biomarkers, including the other health records, including the enzyme reports. And based on this data, it will match with the mechanism of action of drug, MOA, mechanism of action of drug. It matches and it finds out the most appropriate therapy. It finds out the most appropriate therapy for the patient. Okay, for the patient. So it can help the doctors, it can help the prescribers in what? In tailored medication regimens, in optimizing the doses for the patients, right? So personalized medicine is very important. Okay. And then definitely if we talk further, it is like automation. As we talked about, automation also is one of that we already talked about. Automation, like prescription audits, identifying the outliers and drug utilizations and all, we can use. So there are many applications, as we have just discussed: pattern recognition, predictive analysis, real time alerts, decision support, personalized medicine, and automation, right? These are the major things, and what is the advantage? These can definitely help, these are the applications, but why we should use it? What is the advantage of AI? What is the advantage of AI in healthcare, or especially in DUE or drug utilization review, right? What is the utilization? First, definitely efficacy, right? It processes the larger data sets. And then proactive monitoring, definitely the monitoring is very good. Proactive monitoring means like it identifies the issues before the effect, before the drugs affect the patient safety, right? So proactive monitoring is very important, right? And then scalability, right? Scalability means what? You can use AI and ML in different settings, from local hospital to the national wide programs. You can use AI, right? AI is not just restricted like for you or for some like in the top level hospitals only. But if the government even wants, government is applying the AI system. You must have not heard of, but there is a program by government of India which is going on for last almost 4 years. You won't believe that, almost 4 years. And they are doing it for anemia detection. And I think I told you in the last epidemiological course also, they are working on the anemia detection and prevention program of anemia in all the rural settings. Government of India is doing this program, and they are using perfectly, they are using the AIML. Why they are How they are using the AIML? They collect the data of people, they collect the data of pregnant women, they collect the data of women in rural settings, in urban, I mean in the in the settings where no proper diet, no proper food available. And in some slums, or in the what we say that special tribes and all, they are using their they are going, collecting the data, checking the HBs and all. And based on their personal factors, based on their social factors, based on their environmental factors, they are preparing the diet charts for them, they are preparing the diet manuals for them, right? And they are preparing the specific diet manuals for their anemia, right, to enhance the hemoglobin. So this is very important, and the scalability is not a problem nowadays because things are getting cheaper, and even governments are taking such initiatives, right? So if you want to do such projects, you can take help of ICMR. You can take help of DBT, DST, Tata Foundation. There are multiple things which can help you. Okay, and you can take the help of technologies also. And nowadays, I have recently, in Hyderabad, I went to a conference, right? So in that conference, I have seen that these like IIT Hyderabad has collaborated with pharmacy colleges. Okay, IIT Hyderabad is collaborating actually with multiple colleges for different projects. NIN Hyderabad, the Institute of Nutrition in Hyderabad, there is government hospital, I mean government institute, that is also collaborating with IIT Hyderabad, and they are working on some models which can help the public in real time in disease management. Okay, in such chronic disease management. So you can see, just you have to come out of that cell, you just have to come out of that box or well and see the things how these are working. Okay, if you're not getting the resources at your hospital, if you're not getting the resources at your places, definitely come out and check like where it is, and use of such things. Okay, that is very important. So this is the advantage, like this is scalability is not a problem, cost saving is not a problem, because it reduces the administrative burden, it reduces the errors, it can help in the correctness or accuracy of the drug use. I mean, many things are there, it can save the cost in multiple ways. Okay, it can save the cost in multiple ways, but along with that there are some challenges also when we have to talk about like the use of AI. Then we have to talk about the challenges also. First is data quality and integration. Definitely there is no standardization right now. Till right now there is no standardization, right? So no standardization, we have to do whatever is available. With that we have to we have to proceed with whatever is available. Like we need some we really require some comprehensive and standardized data sets for that. And definitely first thing is no standardization, and second thing is ethical considerations, right? That is like ethical considerations on the use of AI in patients, or use of algorithms in patient data. That is very important, right? And the third thing is there is no proper training and adoption, right? There is no proper training and adoption of AI in healthcare system, or in the rural areas, or in the different settings. Only the people who are very much aware, or who are trusting AI, who are embracing AI, are working with AI. Not everyone, not everyone. Okay, so it is very important, guys. It is very important. So now uh now we have discussed about challenges also, right? Now we have discussed about applications and use and challenges, right? Now the important thing comes here is what are the technologies actually, and in what forms we can use, what are the AI tools and technologies, or the formats we can use, right? We can use in DUR or DUE. Okay, DUR and DUE. So guys, focus here, focus. Important thing here is, first is very important, you all must have heard of NLP, right? NLP. NLP is natural language processing, right? Natural language processing, right? Natural language processing, that is NLP. How do we use NLP? How do we use NLP? So NLP is nothing but it extracts and process the information from unstructured clinical notes, research articles. I mean, it collects the data from different sources. It collects the data from different sources, right? Collect the data from various sources, various sources, and it it gives a trend. It gives a trend, and in the systematic way, it gives the trend in a in a systematic way. Trend in a systematic way means like you can identify the off label drug use from the physician's note. Okay, you can use the genetic history from the physician's note. Physician's note are vague, physicians notes are completely vague. But by natural language processing, what the natural language processing can do is it can read the entire notes in seconds, and fraction of seconds, and it can find out wherever, with some specific indicators, with some specific words, with some specific keywords, it can find out like whatever you want, right? It can find out the off label drug use, it can find out the sign and symptoms, it can find out the if you want to check the antibiotic use, it can definitely give you the trend or whatever, it can find out in seconds. So natural language processing the is one of the tool which can help you in getting the structured notes or structured content from the unstructured data, unstructured clinical notes and research articles, and it can definitely compare with the standard version or compare with the guidelines, right? And then second thing is ML algorithms, machine learning algorithms, right? Machine learning algorithms, how it can use, like machine learning algorithms, as I was telling about, predicting the outcomes and optimizing the therapy. It can be done by the learnings. It can be done by the learnings from the historical data. So machines are being learned. Machines are being, taught by the data which is already published, by the books, by the articles, by the real-time data, by the reports. Everything is fed up. Everything is fed in such things like chat gpt. I'll give you the example of chat gpt. So chat gpt is like fed with every type of data. Chat gpt is having the algorithm which can search the data from anywhere, whether it is Google, Yahoo, or the American College of Cardiology, or American Psychological Association, or Indian Physiotherapy Association. Anywhere, from wherever you want, all the websites, all the databases, all the healthcare databases, all type of databases, Scopus, all everything is involved in this, right? So from anywhere, wherever you want the data, machine learning is learned to collect the data, collect the content from anywhere, from the historical data, and based on that, it can predict the outcomes, like classifying the patient's uh, severity, classifying the patient's medication histories, or classifying the like or finding the experienced ADRs in the patient data and all. That can be done with the algorithm system, right? And then definitely when we are talking about AI, we cannot leave the chatbots, right? Chatbots and virtual assistants, right? So these chatbots and virtual assistants are one of the very important thing, and these can guide the entire drug utilization review workflow. It can, these can chatbots and virtual assistants can use can be used to answer the drug related queries, can be used to guide the patients, can be used to guide the patients about counseling, can be used the instant support, can be used for the prescribers again, with the decision support. So multiple things can be done with the chatbots and virtual assistants. So those also you can be thinking of using in your research and using in the drug utilization review. Then definitely there are some big data platforms which are already available, big data platforms where the data is available, so you can just have to go and you have to analyze that data with the help of AI. You can use the large scale drug utilization assessments, like for the country, for the states. And I mean, I'll give you the best example here. We have NIH in US. I mean, don't have, I mean, Americans have the NIH, National Institute of Health, and NIH has the data of every citizen of US, right? Every citizen of United States has the data in NIH. And the people, the researchers from different universities, even my students, whatever, I mean, in whatever universities you are studying, if you want to collect the healthcare data, you have to take the NIH permission, and you can collect the data directly from the NIH, right? If you want the retrospective data, you can directly collect from the NIH in the universities, right? So you just have the access, you can get the big data, and you can analyze that data, you can decode that data, and you can make the research, right? So like if I give you the example, regional pattern of antibiotic use, right, in like Florida, or maybe the California, Texas, or West Virginia, you just have to get the data from those states, and you can compare the antibiotic use, you can compare the anticoagulants use, multiple things you can use by big data platforms, right? Big data platforms. And then let me give you some examples now. Let me give you some examples of that, so you will easily understand. So let me, how many of you have heard of, IBM Watson Health? Guys, IBM Watson Health. IBM Watson Health. How many of you have heard of IBM Watson Health, guys? Tell me. This is one example I'll give you of AI. IBM Watson Health. Yes. How many of you have heard of IBM Watson Health? No? Okay, so go. This is the assignment again for you guys. Go and check what is IBM Watson Health. IBM Watson Health is nothing, but this is the platform which provides drug interaction alerts, right? It provides the evidence-based clinical data, and pharmaceutical data, and it helps in drug utilization review in USA again. Okay, in USA and other countries also. So IBM Watson Health is one of the major and big data worldwide. Okay, big data worldwide. We have IBM Watson Health. Okay, so this is how we can use AI. We can work on AI, and we can, think of the AI use in our DUR models, right? In our DUR models. Now I'll talk a little bit about ML, machine learning. Okay, machine learning. Definitely, it's a new thing. That's definitely it's a new thing for me also, for you also. But try to understand how we can use that, machine learning. Okay, how we can use that machine learning. So I'll just start. Okay, ML in DUE or DUR. Okay, machine learning in DUE and DUR. So what are the applications? First is nothing but predicting the models. Okay, predictive modeling again, because ML is the thing which works on the predictive modeling, right? AI and ML both include, but when we talk about ML, definitely how it works in that, definitely based on the historical data. Again, based on the historical data, it forecasts the future. Like potential medication related issues in the DUR, medication related issues, and then polypharmacy complications, right? Polypharmacy complications. So on what basis it tells about DUR or polypharmacy issues? Based on nothing but based on patient history, based on patient history based on their demographics, right? Based on comorbidities, and based on the prescription pattern. Based on the prescription pattern, it helps in getting the predictive models. Then drug interaction detection is there. Drug interaction detection is by taking the data from EHR. Then anomaly detection also is there. One of the thing, anomaly detection. Okay, anomaly detection can be used by ML, utilization pattern, and like over-prescription of opioids or off-label drugs use. And these anomaly prescriptions means the opioid drug use, over prescriptions for opioids. Like, see, anomaly detection, I'll give you an example. Suppose in Canada, marijuana is, marijuana is legal now. But in certain amount, marijuana is legal in Canada, right? So what they use is, what the doctors use it, they use, they use their positions, they use their prescriptions to prescribe the high amount of marijuana to the patients or to the addictors. Okay, or to the the people who are addicted to marijuana, right? So they do that, right? They do that, and people get the high amount of marijuana. They do that, whatever they have to do, and later the consequences are on public. And the burden is on healthcare system of Canada. burden is on healthcare system of Canada. So Canadian people have, the Canadian government has come up, long back, Canadian government has come up with the restrictions on over prescription of opioids, because after 1 year or 2 years of the legalization of marijuana in Canada, 1.5 year, after 1.5 year only, they had to come up with the restriction on over prescription of opioids, right? So, and how to detect it? They can detect it by the prescription data of the doctors, because I mean, it's not possible in Canada for sure, I'm telling you, but if it is like in USA or in, something like England, like United Kingdom, because they have their own data sets for everyone. They have their own database like NIH or NH, National Health Mission, NHM for England, or NIH, National Institute of Health for America. So they can definitely work on that, right? So they can definitely work on that. And there are there are the things in ML also, like there are supervised learning, unsupervised learning, natural language processing. Those all, whatever we learned in AI, can help in this, right? So can help in this. And definitely other tools are there, like mobile health, we call that M health, right? We call that M health. M health also mobile health. This is mobile, and M health means nothing else but mobile health. So with the help of mobile, we can use for pill reminder, right? Pill reminder applications are there. Adherence tracking we can do. Adherence tracking we can do with the help of mobiles. And direct access to the information. direct uh, Access to the information means, like they can have the direct information to the guidelines, or direct information about the medication and disease, right? Through by using any other databases. So direct access we can give for the medication information. They can get, patient can report the side effects, right? They can monitor their treatment charts and all. They can monitor. So there are many things, guys. There are many things which can be used with the help of these things. And as I told you, there are multiple softwares, there are multiple things which can be done with the help of this. And then digital therapeutics, I already told you. Digital therapeutics, I already told you, that is also called as AI powered interventions in in management and prevention of disease. In management and prevention of disease, usually I'll give you the example here. Like I'll give you the example of some more example of digital therapeutics, guys. That will be great. In 5 minutes more I'll take, then you can understand easily. Okay, you can understand easily. See, suppose mental health. Okay, suppose let's talk about mental health. Okay, mental health, right? So what are the things you can again use this again, I mean, not use this again, you can definitely read about this. There is software and AI powered chatbot called WOE, okay, WOBot. Okay, and there is something called WYSA, okay, WYSA and Wavebot. So these these two chatbots, I'll say these two chatbots are very important, and has been recognized worldwide for what? For the cognitive behavioral therapy. For the cognitive behavioral therapy of the patients. Okay, cognitive therapy for the mental health patients. And it also gives the emotional support. Okay, it also gives the emotional support. Can you understand? It also gives the emotional support. Okay, and as I told you, reset O for opioid therapy, opioid disorders we can use. But for the mental health, WOE bot and Vyasa are AI powered chatbots which are worldwide famous. Okay, like if I talk about neurological disorders, these are I'm just giving you so you can read more stuffs. Okay, and you can understand more stuff. Neurological disorders, if I talk about neurological disorders, there is something called as Endeavor RX. Endeavor RX. Okay, Endeavor RX is the first, guys, you must have not heard of, first FDA approved. Have you heard of Endeavor RX? First FDA approved video game to treat ADHD, in children. Okay, it improves the attention. By improving attention, by improving attention. So Endeavor RX is the name. You can just find out these things, and you can read about these things. Wobot, Visa, or Endeavor RX is one of the amazing tool. I'm telling you, one of the amazing tool. Okay, one of the amazing tool. And in USA and other European countries, or in India also, there is something called Quit Genius. Okay, Quit Genius, QUIT GENIUS. Quit Genius, Quit Genius is again offering the personalized plans and motivational messages, and relapse 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 prevention strategies, comprehensive application. Quit Genius is one of the comprehensive digital therapeutic platform, where it offers personalized plans, motivational messages, it replaces the prevention strategies. I mean, it talks about the prevention strategies, relapse prevention strategies. So there are multiple things where you can look into this, where it can help you. So guys, definitely go and check. Okay, go and check. These are the real time examples I'm giving you. These are the real time examples of digital therapeutics I'm giving you. Okay, so with that, I'll end my class, guys. I'll end my class here. And thank you very much. And now the session is open for the questions. And I'm also sharing the attendance or feedback form for the last day. Sending the feedback form for the last day. Please give your feedbacks and please fill the attendance form, guys. Okay, here is this. Okay, now question. Sir, घर वाले डांट रहे हैं, when will the session end? Whenever you click on the leave, the session will end for you. It doesn't matter. Divyam, it's okay. Whenever you click on the leave, the session will end for you. Yes, guys. Questions now, please.